Hi, welcome to the California Department of Corrections and Rehabilitation's new Employees Orientation, Communicable Disease Training. I am here to tell you about communicable disease. In this section, you will be provided with an overview of the following topics. 1. You will identify the primary methods of exposure and types of diseases transmitted by those exposures. 2. You will be able to select 3 occupational methods which transmit communicable diseases known as bloodborne pathogens. 3. You will be able to list bodily fluids that transmit communicable diseases. 4. You will identify the primary areas of the body most vulnerable to disease invasion. 5. You will be able to recognize the definition of occupational exposure to communicable disease. 6. You will be able to recognize the definition of standard precautions. 7. You will be able to identify what is in a basic personal protective equipment. 8. You will be able to list the 5 actions to take following an exposure incident. 9. You will learn employees' and supervisors' responsibility following an exposure incident. 10. You will be able to identify proper cleanup actions for toxic spills and soiled laundry. Communicable disease is an illness transmitted through contact with microorganisms. People, animals, food, surfaces, and air can all be carriers of the microorganisms that pass infectious illnesses from one host to the next. Communicable diseases can also be transmitted through the exchange of bodily fluids or by having contact with a contaminated substance or individual, any of which may be enough to allow a communicable disease to spread. Training on communicable disease prevention, bloodborne pathogens, aerosol transmissible diseases, and methicillin-resistant Staphylococcus aureus is required at the time of initial assignment where occupational exposure to these diseases may take place, and at least annually thereafter as required by the California Code of Regulations, Title 8, Section 5193, Bloodborne Pathogens, and as enforced by the California Program for the Federal Occupational Safety and Health Administrations, also known as Cal-OSHA. In accordance with these regulations, we are providing this training. In addition, because any staff may have possible exposure to diseases other than bloodborne diseases, we are providing training on preventing contact with other forms of occupational exposure. It is extremely important for your health and the health of your family that you learn basic lessons in disease prevention and protection and practice standard precautions every day. All human beings have the potential to infect you with disease. Often, prisoner populations have a higher than average incidence of these infectious diseases. You may be in constant contact with persons who potentially have infectious diseases. You must consider that anyone you have contact with may be possibly infectious. You must constantly take steps to protect yourself from exposure to disease. If you're working around inmates, you will have a greater risk of exposure. Learning Objective 1. You will identify the primary methods of exposure and types of diseases transmitted by those exposures. Although classified as bloodborne, these diseases can be transmitted from other bodily fluids such as semen, vaginal secretions, breast milk, spinal cord fluid, brain fluid, other organs, and joint fluids. Bloodborne pathogens are present in human blood and can cause disease. The first example of a disease transmitted through bodily fluids is human immunodeficiency virus, also known as HIV, which is a virus that can lead to acquired immune deficiency syndrome, known as AIDS. A second example of a disease transmitted through bodily fluids is hepatitis B virus, or HBV, which is a virus that attacks the liver and is 100 times more contagious and more concentrated in the blood than HIV. The prevention is a vaccine. The third example of a disease transmitted through bodily fluids is hepatitis C virus, or HCV, which is a virus that attacks the liver in which 80% may become chronically ill. Examples of skin contact disease include methicillin-resistant Staphylococcus aureus, also known as MRSA, which is a staph infection resistant to treatment, and lice or scabies, which are insects that carry diseases found in inmate living areas. Examples of airborne diseases include tuberculosis and colds and the flu. Learning Objective 2. You will be able to select 3 occupational methods which transmit communicable diseases. Occupational transmission include conducting cell, body, and area searches, gassing, subduing altercations, performing medical procedures, being a first responder and performing procedures like CPR, first aid, etc. Learning Objective 3. You will be able to list bodily fluids that transmit communicable diseases: blood, semen, vaginal secretions, breast milk, saliva, cerebrospinal fluid, pleural fluid, peritoneal fluid, amniotic fluid, synovial fluid, pericardial fluid, airborne pathogens.
Learning Objective 4. You will identify the primary areas of the body most vulnerable to disease invasion. The most vulnerable areas of the body to disease invasion are cuts, such as lacerations or tears, abrasions, such as sores, scrapes, or scratches, mucous membranes, such as the eyes, mouth, or nose, and punctures, such as a finger prick. The acronym CAMP is an easy way to remember these areas. Learning Objective 5. You will be able to recognize the definition of occupational exposure to communicable disease. Occupational exposure is defined as reasonably anticipated skin, eye, mucous membrane, or peritoneal contact with blood or other potentially infectious materials that may result from the performance of an employee's duties. Jobs with exposure risk include non-custody, non-medical staff, medical staff, custody staff, and first responders. Learning Objective 6. You will be able to recognize the definition of standard precautions. Standard precautions refers to a certain infection control steps that medical professionals take to reduce the risk of transmitting HIV and other infectious diseases. The scientific basis of standard precautions is that individuals should treat any blood or bodily fluid as though it contains hepatitis, HIV, or other infectious agent. Learning Objective 7. You will be able to identify what is in personal protective equipment. Preventing exposures includes avoiding contact with bodily fluids. Standard precaution equipment includes absorbent powders, bodysuits, cleaning and disinfectant solutions, eye shields such as goggles or safety glasses, face masks, gloves, and shoe or boot covers. Use a barrier to protect portals of entry. The 6 portals of entry for agents are the respiratory tract, the conjunctiva, or the lining around the eyes, the urogenital tract, the gastrointestinal tract, transplacental, such as from the mother to child, and skin when it's broken or open. Learning Objective 8. You will be able to list the first 5 actions to take following an exposure incident. Following an exposure incident: 1. Remove contaminated clothing and equipment. 2. Clean wounds and give first aid. 3. Classify the level of exposure. 4. Get medical evaluation. And 5. Get preventative treatment as appropriate. Learning Objective 9. You will learn staff and supervisors' responsibility following an exposure incident. The employee's responsibilities are to immediately inform their supervisor of the exposure. The supervisor's responsibilities are to maintain contact with the employee, initiate incident reporting, facilitate transportation to off-site and medical care as necessary, arrange for peer support program or the employee assistance program, provide a copy of the workers' compensation form SCIF 3301, and follow up to ensure required documentation of the incident is completed. Remember, the employee may not be detained at the facility or place of work longer than is necessary to provide first aid and classify the level of exposure. Learning Objective 10. You will be able to identify proper cleanup actions for toxic spills and soiled laundry. A clean and sanitary worksite is essential to reducing health and safety hazards. A toxic spill is a safety hazard and must be removed immediately to prevent accidents. Employees who become aware of a toxic spill should ensure it is cleaned up immediately by either doing the cleanup or arranging to have it done as appropriate. Appropriate cleanup action for soiled laundry. Laundry, such as sheets, towels, and clothing that have been soiled with blood or urine, should be handled as little as possible due to possible exposure to bloodborne pathogens and only with proper personal protective equipment. Soiled laundry should be placed in a labeled yellow waterproof laundry bag for transport. In conclusion, we have studied the 3 types of bloodborne pathogens covered by Cal OSHA and identified the bodily fluids capable of transmitting them. We discussed implementing standard precautions. Remember, always use standard precautions no matter where you are. Staph infections are becoming more and more common, even among people that are not members of high-risk groups. It is essential that you practice standard precautions at all times to avoid infectious diseases. Treat all contact as potentially contagious and take precautions accordingly. Perform hand hygiene consistently. Improving personal hygiene is essential in preventing the spread of infectious diseases in our worksite. Thank you.
Knowledge Review. The purpose of this activity is to reinforce what you have learned from this training. True or false? You can get a communicable disease from saliva. True or false? Take a moment to answer the question on screen. The correct answer is true. True or false? Definition of occupational exposure to communicable disease is reasonably anticipated skin, eye, mucous membrane, or peritoneal contact with blood, or other potentially infectious materials that may result from the performance of an employee's duties. True or false? Take a moment to answer the question on screen. The correct answer is true. True or false? Definition of standard precaution is refers to steps that medical professionals take to reduce the risk of transmitting HIV and other infectious diseases. True or false? Take a moment to answer the question on screen. The correct answer is true. True or false? Bodily fluids, skin contact, and airborne are the primary methods of exposure. True or false? Take a moment to answer the question on screen. The correct answer is true. True or false? These are the first 5 actions to take following an exposure incident. 1. Remove contaminated clothing and equipment. 2. Clean wounds and give first aid. 3. Classifying the level of exposure. 4. Medical evaluation. 5. Preventative treatment. True or false? Take a moment to answer the question on screen. The correct answer is true. True or false? It is the employee's responsibility to immediately notify their supervisor of an exposure incident. True or false? Take a moment to answer the question on screen. The correct answer is true. True or false? Soiled laundry should be handled as much as possible. True or false? Take a moment to answer the question on screen. The correct answer is false. Which one is not an occupational method which transmits communicable diseases? Watching TV at home. Subduing altercations. Performing medical procedures. Take a moment to answer the question on screen. The correct answer is watching TV at home. The most vulnerable areas of the body to disease invasions are cuts, abrasions, mucous membrane, and punctures. What is an easy way to remember this? COMP. CAMMP. CAMP. Take a moment to answer the question on screen. The correct answer is CAMP. What is the basic, personal protective equipment to preventing exposures? Avoid contact with bodily fluids, standard precautions equipment, use a barrier to protect portals of entry. Sunglasses, sunscreen, and a visor. Umbrella, raincoat, and rain boots. Take a moment to answer the question on screen. The correct answer is avoid contact with bodily fluids, standard precautions equipment, use a barrier to protect portals of entry. On the following screen, you will receive a blank certificate for this training. Please pause the video on the bottom left of your screen, video player, once you see the certificate. Then select the print screen button on your keyboard. Paste the image into Paint. Here you may crop and print the certificate to turn in. End of training. This concludes your training. Thanks for watching and participating.